just so we can get the vent up and running. All right, so when we're on this standby mode, we can set our settings here. So if I click on adult, you can see that I have the option to choose pediatric, neonatal, or adult. Probably not going to be venting in neonatal mode. It's probably just going to be pediatric and adult. Your neonatal circuits require an extra connection point in one of these modules that you don't have. So that answers that. You're just going to be venting in peds. You're going to make sure that your ventilator type is set to invasive ventilation. And then we're going to go to our ventilator mode, where you can see we had all those options. So in an emergency, if you're setting this up and you're having to start with your safe start settings, we're going to select pressure control. And then we can select all of the settings we can manipulate with pressure control here. So to start it out safely, we're always going to start at 100%. So you can go up with these arrows, or you can drag the thing. It's going to be really mad at me, actually, because we're not connected to oxygen. So you should start at 100%, but we're going to keep it at room air. A PEEP of 5 is pretty good. Sometimes we have to go up. Respiratory rate anywhere between 15 and 20. Pressure control above PEEP means the additional pressure on top of PEEP that we're going to be delivering a breath to. So if my PEEP is 5 and my PC is 15, that means this ventilator is going to deliver a breath to a peak pressure of 20 centimeters of water. It's fine with me. Then we have our inspiratory time, our rise time, and our trigger. That we're not going to get into too much, but we'll give you safe starting recommendations. So that's essentially how we're going to manipulate our inspiratory to expiratory ratio, which should be between 1 to 2 and 1 to 3 when we're starting out. So if I have all my settings and I'm happy with them, which I am, I'm going to go ahead and hit start ventilation. It's going to tell me that I am a slacker and need to do a pre-use check. I am, and then it's going to, it's going to yell at me again. And then it'll start ventilating. Okay. So this is perfect because it's alarming at us. I'm going to turn the audio off. So you can see that I've got a high respiratory rate, and that's why it's yelling at me. It's because this bag's just flapping around. Lungs don't do that, so it thinks it's the respiratory rate. And that my O2 supply pressure is low, which we know because it's not plugged into oxygen. So if I open this up, I can see it says O2 supply pressure low, check your O2 supply. So it really is going to bring it down to the most simple level so that no matter how intense you are because an emergency is happening and this thing's screaming at you every which way, it's really, really easy and step by step. And you can expand it with those arrows. So even something like a high respiratory rate, it's telling you check your patient, then check your ventilator settings, and then check your patient circuit. Check for all of those things to troubleshoot why this respiratory rate is high. And that is it. So if we wanted, you can expand these little arrows and you can get the full picture for your patient. Most of the time this is going to be sufficient. And you can see I can expand this arrow and I can pull up all of the things that I might be manipulating during the course of ventilation. Your O2 boost button is here. It is grayed out right now because it knows we're not connected to oxygen. Your disconnect button is here. And it's going to walk you through exactly what the process is to disconnect a patient and how to set this machine so it can then start delivering oxygen when you reconnect. So it really truly walks you through everything. You can go to different views. So if you, this is going to be potentially something that you might do if you have clients visiting and you don't want this to be distracting. You have two different views that I like to use for clients. The first one for my sick patients is distance. So I can stand way in the back, they can be right with their patient or their pet, and I can have these big numbers to make sure everything looks okay. But we can also go into family view where it's just a little bit more peaceful. You can lock the screen if you want to. I'm not sure why you would, but you could. But most of the time we're going to be venting in probably either advanced or loops. So we're going to look at our loops and our scalars to get an idea of the pulmonary pathology, and they're going to look insane because that's a reservoir bag right now instead of a lung. But this is probably where you're going to have your settings, so that if there is a problem and you have to screenshot it or record it, whoever you're sending that screenshot or recording to is going to have this information. If you are troubleshooting something and you're just giving them this, that's a partial picture. So I do recommend hanging out in either advanced or in loops. And then of course you can hit your recordings here. So right now it's going to record 15 seconds before I hit that button and 15 seconds after, and then it's going to store it in the library. All right, get on up here, start touching things.